the Catalyst interns that have joined the call, and as well Nate Prorak, Sohaila Shah, and Rupa Ramamurthy of the Catalyst program. And I also want to thank the industry advisors that have joined. I see a couple, and the PIs for joining as well. Now, this is the third workshop, and I'll remind you that we're creating these TPPs sort of sequentially from medicine to the technical engineering pharmacology, and then the business fields. And this is the workshop that's focused on business and regulatory and the like. And we're lucky to have two speakers. The second is Sohaila Shah, part of the Catalyst program, and she'll be speaking the second half hour. But the first is David Pudwell, one of our totally key Catalyst industry advisors. David studied engineering both at Case Western, and he has got a master's in biomedical engineering from Johns Hopkins, and then a business degree from Harvard. And he's worked at the FDA as in regulatory, obviously. And regulatory considerations are absolutely key to healthcare product development, whether it's a new drug or a digital health or a medical device. And even though David's expertise is sort of more, I think, in the medical device space, he's obviously broad in his knowledge around around FDA and the like. And so without further ado, I'm going to turn it over to David Pudwell here. Thanks again, David.
Hey, it's great to be on. So let me see if I can actually share a screen here. And we'll do this. So hopefully you can see my screen there.
No, actually, we can't. We cannot. We can see you.
Okay, here, let me see. Share, screen 3, share. All right, is that working?
It sure is.
All right, perfect. So let me go ahead and move some things around. Okay, so that should be good. So today we're just going to talk a little bit about some regulatory aspects of healthcare product development. And thank you for the kind introduction, Charles. It's really appreciated. So I'm David Pudwill, and some people call me Mr. Regulatory. And we'll jump right into it. You can email me if you have any questions or if I can be of any assistance. Don't hesitate. Don't hesitate to reach out. So first, want to give a little bit of an overview of how we got here. And I really love this image. So hopefully you guys can see this. This really gives you a sense of how FDA sees the world. And there should be a link at the end of my slides here for where you can find some of these FDA images. But the world is full of an array of hazards. That is how you should be thinking when you're putting yourself in FDA's sort of headspace, when you're putting on their rose-colored glasses, how they see the world. They see hazard, they see danger, they see harm. And so it helps if that's where you're putting your frame of reference when thinking about how FDA is going to see something that you're putting in front of them. So you want to start there in terms of trying to de-risk your submissions, your interactions, all of the ways that you interact with FDA, recognizing that first and foremost, this is how they're going to see anything you put in front of them. They're not going to see it in the most positive light. They're going to see it in, first and foremost, generally the most negative light. And anyway, especially for somebody who's an inspector or an investigator at FDA, and those are the people that generally those of us outside of FDA are interacting with on a more regular basis. And a little bit of background in terms of, we'll go through a little bit of a timeline here. I'll show you, some of the history, but what started a lot of the regulation that FDA does, first with food, then with drugs, then with medical devices. Really, when you look at the history, of what found its way into various drugs and foods, it was a lot of poison. And so FDA's way of seeing the world as an array of hazards really does align, at least with how some people operated in the market before we had some of these regulatory controls. I personally, as an ex-FDA person, happen to think sometimes FDA goes too far. But nonetheless, like I think there's a place for a lot of what FDA does, and I think that it's important. So here's a little more sort of interesting images that give you a little bit of history. There are here we have candy that contain prizes that may injure the teeth of children. So FDA ends up getting involved in a whole lot of things that are sort of adjacent to food, and when we're just thinking about risk to human health and promoting human health. And this is really where FDA's mission comes in. And another little example, I find this image quite striking. This is a little call out. Anyway, there's some stuff here on the slide, but the most striking image is off to the right hand side here of a woman who used this particular product to remove hair from her body, but she did not apply it to the scalp. And meanwhile, she's lost a whole bunch of hair on her scalp. So that's sort of the start of where things are. We get a little bit more into the modern era here, where there are these firecracker balls. They look like candy, but they're firecrackers. And we just had July 4th celebrations, and fortunately, you can't go find these on the market. A bunch of children were chewing down on them and causing lots of harm to themselves, and so FDA got involved in even some things like these, things like this that are not exactly where you would expect FDA to be involved, but because of the human health aspect. So here's a little bit of a timeline. I won't go through all of it, but you see a whole lot of presidents involved, a whole lot of change that's happened in terms of FDA, what it's regulating, what the scope of FDA's authority is, and then on into the modern era. And every recent president has been involved in expanding the scope of what it is that FDA does, or reauthorizing additional user fees and things like this. So it's fairly bipartisan, and it has been historically, in terms of the support both in Congress and within the executive branches for what it is that FDA is doing. So what is it that FDA does? Well, as we talked a little bit before, FDA is responsible for protecting the public health, and they're also responsible for advancing the public health. So both ensuring the safety and efficacy of drugs, biologics, medical devices, etc., as well as helping to speed innovations. And FDA talks a lot about both of these sides of the coin in terms of what they're tasked with doing. I would say FDA generally is more successful in the first sort of responsibility than in the second, though they make a lot of noise about trying to help speed innovations, and they have a lot of programs that are designed to try to reduce some of the burden or accelerate innovations onto the market. I would say generally, when you look at the actual data, it's somewhat murky, and if anything, some of these innovation programs can actually sometimes have worse outcomes in terms of time frame than if you were to just use the regular pathway. And it's difficult to say exactly, whether that's because of the pathway itself, or whether this is because it's just that new innovations sometimes take longer to get onto the market. But nonetheless, the jury's still out on whether FDA effectively, I would say, does the second one. So how is FDA organized? Well, FDA has a number of centers. It covers veterinary medicine, drug evaluation and research, biologics, devices and radiological health, which is where I spent some time. I also was in the Office of Legislation for a little while, which is at that office of the commissioner level. And I spent time both in the cardiac group and also in gastrorenal endoscopy, transplant, and obesity devices. And anyway, there have been some changes since I was at FDA just in terms of structure, but that's where the groups I was in currently reside within FDA. So a good question to start with here is what is a drug or a biologic? Because the definition for a device ends up being more of a negative a definition in terms of what it's not, first and foremost. And even, in terms of, what's happened with devices being regulated after drugs, there's even a negative definition here in terms of what is a drug or a biologic, and it's not a device or a component, part, or accessory of a device. So it's kind of interesting that you have these definitions which are interlinked. I would say somewhat confusingly, actually. But anyway, so a drug is defined as a substance that's recognized by an official pharmacopoeia or formulary, a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. And it's a substance other than food that's intended to affect the structure or any function of the body. And as we can see here, it's not a device or a component or part or accessory of a device. And biologic products are included within this definition and are generally covered by the same laws and regulations, but some differences exist regarding their manufacturing processes. And this is where you're either, sort of looking at more chemical processes, or you're looking at more biological processes generally in terms of whether a product is regulated by the Center for Drugs or the Center for Biologics. And then here's a little bit about the timeline. You start with drug development. You move into animal testing and an IND application, which is to do some of your initial studies. You move into phase 1, phase 2, and phase 3 studies, and you get a sense of sort of directionally, double digit, triple digit, and then you get into the thousands in terms of your sort of phase 3 studies in terms of how many patients you have. Then you move into having drug labeling based on the clinical evidence that you collected. You go ahead and you submit your application, and you have a facility inspection. And so there's a whole lot of work that goes into this. There's a review meeting that FDA will hold as part of an NDA application. And anyway, and then you move into what's sometimes called phase 4, which is more the post-marketing, FDA's post-approval risk assessment of ongoing safety for drugs. And this is all generally going to also be true for biologics. Right? So then I guess the next question to really confront, for those of you who might be working on, some of these medical device products this summer here is, what is a medical device? Well, a device is an instrument, apparatus, implement, machine, contrivance, implant, in vitro reagent, or other similar or related article, including a component, part, or accessory, which is, again, there's a real mouthful. The bureaucrats don't know how to write simple language. But recognized in the official national formulary or the United States pharmacopoeia or any supplement to them, intended for use in the diagnosis of disease or other conditions, or in the cure, mitigation, treatment, or prevention of disease. And you'll actually see how some of this gets broken out in terms of specific regulatory classification numbers if you go into the CFR, or the Code of Federal Regulations. and intended to affect the structure or any function of the body of man or other animals. And so medical devices for veterinary use are regulated, but generally the Center for Veterinary Medicine allows you to use those devices in animals without having to jump through any hoops, and which does not achieve its primary intended purpose through chemical action. So that would make it a drug. And it's not dependent upon being metabolized for achievement of any of its primary intended purpose. So, or purposes. So, primary mode of action is something to think about. So, I'm actually dealing with a situation right now where we're talking with the Office of Combination Products at FDA. And this is a group which sort of sits between each of these regulating centers. And they decide which of those centers has what's called jurisdiction over a particular product. And so we've been having some interactions. We sent some, correspondence into the Center for Devices, and they told us, we think you're a drug. And we quite, vehemently would disagree with that, presumption. And we're now working through, with the Office of Combination Products, and also talking with, some folks at the Center for Devices still, in trying to sort out that, that whole situation. But anyway, so this does happen where, you end up having, jurisdictional questions about, is it a drug? Is it a biologic? Is it a medical device? I'd say generally it should be relatively clear, but there are some strange cases where you can run into some disagreements, or have some discussions about how something actually is regulated and which center should have primary jurisdiction. Digital health is something which can cross over, between the centers in terms of its implications. But this is something that CDRH has really spearheaded. And generally, if you're going to be developing software or anything in this sort of digital health space, wearable products, and you're doing telehealth and telemedicine and personalized medicine, a lot of these products are then going to be regulated by the Center for Devices and Radiological Health. And I know we have a number of, various software projects as well. Now, FDA has been trying to make some headway here. They did a software pre-cert or a pre-certification pilot program a couple of years ago, and FDA currently believes that they need more regulatory authority than they currently have to expand that more broadly. So we'll see what happens there. But generally, if you're waiting on an act of Congress, I wouldn't recommend that you hold your breath. So in terms of that digital health space, there are mobile medical apps, and these are software programs that are going to run on your smartphone or other mobile communication devices. And the FDA is really taking a risk-based approach, really across all software products. And this is going to focus on each individual software function. Okay, but there are a small subset of mobile apps that meet the regulatory definition of a device, and that are intended to either be used as an accessory to a regulated medical device, or transform a mobile platform into a regulated medical device. And this can range over a broad set of various health functions. And while most mobile apps carry minimal risk, those that have a higher level of risk do require FDA review. And FDA has outlined this in various guidance documents. FDA has enforcement discretion for a number of mobile apps and for a number of various software functions. These are software functions that generally will help patients or users self-manage their disease or condition, provide patients with simple tools to organize and track their health information, provide easier access to information about health conditions and treatments, help patients document, show, or communicate potential medical conditions to healthcare providers, automate simple tasks for healthcare providers, and also enable patients to interact with their personal health records. It's important to note that that electronic health record, um, uh, I guess I should say that the mobile medical app policy that FDA has put in place doesn't apply to mobile apps that function as an electronic health record system or personal health record system. So now I want to jump into just a couple basic principles. Okay, first and foremost, whenever you're going to do anything in an FDA regulated space, you need a regulatory strategy. It's very important, and this is a living document and plan that helps you outline the activities and planned actions, the benefits and risks that you're going to have to be navigating, and what your options are for moving forward. You're going to want to make sure that you have a business strategy for the product. This is going to be incorporated and integrated with your regulatory strategy. And you're going to want to have some kind of a regulatory assessment that looks at your pathways to market and the current regulatory environment, and really, does a little bit of a regulatory risk assessment in terms of what your potential outcomes are as you're moving forward in terms of your regulatory submissions. So, first and foremost, a regulatory strategy is not just a bunch of documents. It's not just a blueprint or a roadmap, and it's not something that is fixed, right? It's a living, breathing kind of a set of set of documents that you have. You really want it to be something that will develop over time, and that you can keep moving and adapt to what the current environment is and what your current approach is when the product changes, when the environment changes, etc. And it's important to recognize that really everything is good until it isn't. Okay, and you want a degree of predictability. So that little it's far off. You haven't really figured out exactly what's happening with your regulatory strategy. You think that it's a class 1 product and you find out it's a PMA. These are the kinds of things that can sneak up on you if you don't have a little bit of predictability and a better plan. It's important as you're thinking about your regulatory strategy, as you're thinking about whatever it is that you're going to be doing, that you want to really, especially if you're going to use a contract manufacturer, go visit, figure out, what they can do for you. Are you making devices? Are you making drugs? Generally, a lot of products, if you're making something physically, you're going to start out using a contract manufacturer, or you might start out very, very small in-house. But you're going to want to figure out what capabilities that contract manufacturer has, and first and foremost, go and visit and ask questions. And as you move forward with verification and validation, activities, a lot of us sort of expect that we're going to have this, smooth glide path, forward. We can outline, what all is needed. And, quite frankly, from working through a number of various projects from start to finish, reality is rarely, that. It's, it's brutal, it's cold, it's harsh. You're climbing, basically the cliff face, somewhere in the Alps. That's at least how it feels when you're in the middle of it. And really when you're thinking about clinical studies, and especially for those products that need them, and there are a fair number of higher risk products that do need clinical studies, and even for those products that don't need a clinical study to get onto the market, you generally need to develop some kind of clinical data to get reimbursement or to drive adoption. And you should really start by thinking outside of the box. What data do you have? What can you leverage? It's interesting how many times I talk with people and they already have data, but they don't think that that data can be used for a regulatory submission, or they don't think that that data will help them get where they're trying to get to. And usually you want to first take stock of what you have, or of what the client that you're working for, or what the company that you're working with, what do they have already? Like take a good stock of that, because oftentimes there's more there than you might think at first glance. And then, as you're thinking about clinical studies, it's really important to, I would suggest, push the envelope. Okay, you want to really figure out how to get as much out of a clinical study as you possibly can. And you also want to make sure that you have adequate oversight of your clinical, study sites, of a CRO if you're working with them. This is where a lot of things can fall apart. Is if you're running the right study, you're running the right design, but you don't have good oversight of your clinical study. That can get away from you really fast, and now you have to go back to the beginning and collect a brand new tranche of data at a new clinical site, and you don't want to be in that position. So make sure that you have really good clinical trial oversight if you're running clinical studies, and really make sure that you have a sense of what those timelines look like, both in terms of sort of the best and the worst case. But first and foremost, it's important to really don't panic. That Hitchhiker's Guide to the Galaxy, famous quote. Really, that's the place to start. Don't panic. Assess what you've got. Consider what pathways are available to you, what partnerships you might be able to take, and what the reality is in terms of the timeline. Also, develop a relationship with FDA. You want to introduce your device. You want to generally start early. You want to make sure that you've asked them some scientific questions, but you can also do some other early submissions where you're just sharing with FDA and you're starting to build that relationship. And it's also important, as you're building that relationship, with FDA, to understand what it is that your investor needs. Because oftentimes, a lot of these projects that we're working with, they're driven by investment capital. And so you need to understand what you need from FDA for your investor. And, you really need to come to an agreement on, sort of terms of engagement there. So a couple quick questions. When do you submit a pre-sub? Well, either you have a new device or technology. Maybe, you can, get engaged with FDA very early on, even before you have questions. You've got a first of a kind, indication or a new indication for an existing device. You have an unclear regulatory pathway, and there are a couple other, considerations for IVD products here as well. Just want to highlight an informational meeting as one option for you. So even if you don't have any questions for FDA, you can do an informational meeting with FDA, and you can share information with them, share what your plans are. And the idea is really familiarize FDA with your technology and help them plan for future submissions. And then, there are really, a couple common mistakes in engaging with FDA. So number one, not considering the timing of the request. So, you need to make sure that you have time to integrate what it is that the feedback is from FDA. Okay. But also you don't want to ask FDA questions after you've already conducted, the studies either. So, you generally want to be earlier on than you might think. It takes time to get that feedback from FDA. You should plan on 90 days, to get that feedback, and that's a whole quarter. That is a lot of time. And then the other common mistake is just failing to get clarity. The pre-sub program it's not intended to be a multiple round discussion, though sometimes it turns into that. you want to try to make sure that you get clarity following FDA's feedback to you in a timely, sort of close, proximal way. So in the meeting, you want to try to get clarity on what it is FDA's told you. And I can't tell you the number of times I've seen that, that situation backfire for companies, both when I was at FDA and since leaving FDA and helping companies navigate, situations that they found themselves in after having had a meeting, not getting adequate clarity, and then going off and doing what they thought FDA asked them to do, and then coming to find out that FDA had something else in mind entirely. And I think we're just out of time, so we might go ahead and stop there. What do we think?
Hey, David, that was really a great that was really a great overview. Um, I can't, I'm looking to see if there's any questions. I do have a quick question that I'm not going to be able to articulate very much, but the Supreme Court ruling of a couple weeks
Mm.
ago involving, I don't know what they call it, the Chevron case
Chevron
or this and that.
deference, or yeah,
And I've read a few things about it in the newspaper. It boggles me a little tiny bit, but can you just explain the potential implications of the Supreme Court decision with respect to, let's just say, the power or the
yeah,
influence that FDA has as the final
yeah.
arbiter versus, go ahead.
Yeah, so I think it starts with we used to have a lot more trust in our institutions. So like sort of the story to sort of frame what's happened with Chevron deference is we used to trust our institutions like FDA. And I think over the course of, and for a number of years, legal scholars have wanted to rein in things like Chevron deference. It's sort of led to the promulgation of a regulatory state. In some instances where there really isn't good framing from Congress around what the boundaries are here. And generally, what this has led to is a situation where FDA, if Congress didn't clearly say they couldn't do something, generally the agencies can, have a pretty broad, sort of reading of what Congress has tasked them to do. And with the erosion of trust in our institutions, I would say, we've led to a situation where the courts are now going to be a lot less deferential to the regulatory agencies. And for FDA, this means that things like the LDT rule that FDA was trying to push forward without Congress having, clearly, made a, had a position on this. We were looking for Congress to actually act on LDTs one way or the other, but they haven't. So FDA decided they would go ahead anyway. This is the kind of thing that is going to get reined in with this change in terms of, sort of Chevron deference. And then there are some other things that FDA has recently done around indications for use and really cracking down a little more on off-label use in the U.S. That's also going to get reined in more, where FDA is not going to be able to take the same sorts of stances around off-label use, in terms of how companies navigate, that. So companies have a little bit more freedom. You don't have a ton of freedom you can't promote a product for off-label use, but FDA was starting to crack down on people whose products had known off-label use, even if they weren't actively promoting them. So there's some of these kinds of things that are getting reined in related to Chevron deference around sort of how FDA can act and what freedom they have to operate.
All right. Hey, thank you so much again. Really appreciate it. And hopefully some of these people will be reaching out to Mr. Regulatory for some official assistance. So I really appreciate it.
Absolutely. And I'll share, there's a bunch more in here, mostly about medical devices, but I'll share a whole, bunch of slides, with you,
Oh, that'll be
guys, and
great.
you can take a look at them.
Thanks a lot.
So
Really appreciate it. Okay.
absolutely.
Thanks again. Okay. Second half of our workshop today is going to be by Sohaila Shah. Sohaila, part of the CALIS program. She's got a PhD from Tufts in genetics and genomics, and then did postdocs at UCSF and Memorial Sloan Kettering, and then worked in the private sector, most recently at Invitae. So, so Hayla's career has been in molecular diagnostics and the like. And today she's going to be talking about the business fields of the target product profile. So take it away, Sohaila.
Right. Are you guys seeing my screen or not yet?
Yeah, we are right now.
Okay.
It was toggling back and forth, but now it's your first title slide.
All right, great. Thanks. Yeah, I was starting to get into sleep mode with my computer for some reason. Anyway, so David is going to be a tough act to follow because my slides are not as fun as his. But hopefully we'll get through these and you will learn some important things to complete the business fields of the target product profile. What I'll be focusing today is on how to research and analyze the market to make some key decisions for your product development and bringing it to market. So what we'll do is briefly talk about why you need to do market research, which is going to be stating the obvious in some ways. And then we will get into the key activities that you will need to focus on for the TPP. These include identifying the unmet need, doing some market sizing for understanding the economic value, doing competitive analysis, and then deciding whether you're going to out-license the technology or do a spin-out. So why do you need market research? You need market research to really get valuable insights into what the current gaps in the market may be, to make informed choices so you can pursue the right products and position them for success. And then you can also learn about potential risks and challenges early that would enable you to really adjust your strategy. So my slides are somehow going on a time of its own. So starting out, we're going to talk about identifying the unmet need. And what I mean by that is finding the gap in the existing products and solutions that are out there, really trying to understand what the customer requirements, pain points, and preferences are, looking at the market to see what the emerging trends might be so you can position or develop products accordingly. You want to be able to see if there are untapped market segments that you can sell your product to, and really understanding the competitive landscape to position your product against them. And how do you learn more about what the unmet needs are? So, you'll hear about this in a workshop a couple weeks from now. But really what you're looking to do is get out of your comfort zone, get out of your office and talk to people. And this means conducting interviews, focus groups, and even sending out surveys where you want to focus on getting clear understanding of the gaps by asking open-ended questions. So you don't want to ask leading questions that would make people tell you they want your product. You want to, once you ask your questions, you want to really pay attention to what people are talking about, what they like, what they don't like, and really dig into by asking follow-up questions. You want to understand what your competition is, and if you're able to really get a sense of how they're pricing their product. If you have developed a prototype, this would be a time where you would bring it out. So I would never lead with the prototype if I was doing a customer interview, but after I understand the customer needs and I have a prototype that might address them, I would do a demo and then ask more questions and try to get feedback and comments from users or potential users. And in addition to talking to people, you can also take advantage of a lot of market data that's out there in the form of market reports. The one source of data that we have is Global Data. It's a platform that will help you find information on therapeutics and medical devices. If you have a UCSF email, you can get access to it. You just have to talk to us. You can do some internet searching by just simply Googling to get more market information. And these days, we have Gen AI, ChatGPT, and cloud, and you can start asking informed questions and get some answers about your market. So now that you have a product or technology that you have developed, you've identified your unmet need and a market for it, you want to see how big that market is, because in order to develop a product, it has to be viable, meaning if you're going to spend money on it, you have to be able to make money from it. So in order to size your market, what you need to do is really first define what that market is, who you are selling to, what regions you're going in, what product features you're going out with, and then pick out the metrics that you're going to use to do your sizing. So either pick revenue, how much money you can make, or you could be thinking about it in terms of how many units you sell. And then go on to do more research. Like I said before, you would have market reports that would tell you, give you some numbers around how big the market is, how many people could potentially be using your product. There are publications that might give you this information. You could do some statistical analysis and surveys to get a sense of the number of people using the product or the size of the market. And once you get these numbers or data, you want to start doing some extrapolations, look at growth rates, maybe even start to break down the market into segments if you have a product that fits into a niche. And then you start to go on and size the market. So what I'm going to do now is I'm going to take two examples, one from an early cancer detection test and another one for a wellness app. It's a made-up example. The first one is a real example. The second one's a made-up example, just to help you think through the process of market sizing. So the first product that I'm going to talk about is an early cancer detection product for colorectal cancer. So colon cancer happens to be the third most common cancer diagnosed in people in the US. And as you can see from this table, survival rates are really good if it's localized, and they can drop drastically once the cancer metastasizes to distant regions of the body. And therefore, we know that if we have early diagnoses, we can almost have complete cure for the disease and people survive. So what you need here in terms of an unmet need, or the need for the patients here, is for an early cancer detection solution. And today in the market, we have several technologies and tests available, including colonoscopy, certain stool DNA and immune tests, or doing a CT colonography. And, we know that people over 45 have been recommended to get cancer screening early, so as to detect the cancer as early as possible. But most people don't like to go in for a colonoscopy because it's a super invasive procedure.
Oh, yeah, you can use mine.
Somebody might need to mute. And other tests are not as reliable. There's nothing that is particularly convenient. And as a result, we find that 75% of people who die from colon cancer have died because they were never screened. And over 40% of people never get screened at all. So what we're really looking for is a convenient, less burdensome, and easy to administer test. And so here is where the product that I'm going to talk about comes into play. It's a product by a company called Guardant, and it's known as Shield. This is a blood-based test that uses next-gen sequencing to analyze circulating DNA. It's non-invasive, unlike colonoscopy, and it can be done using a simple blood draw during your routine office visit. So we've identified that this product has a market and a need. So now let's go ahead and size it. So for sizing this market, I'm actually using the numbers that were published by Guardant in one of their earlier quarterly earnings reports last year in 2023. And for market sizing, you're looking at three things. You're looking at the total addressable market, the serviceable addressable market, and the serviceable obtainable market. So total addressable market is if the product or service that you provide is used by every single user who is eligible to use your product, you have your total addressable market. So in this case, if we think about everybody who is between the ages of 45 and 85, who would be recommended to get routine screening on a yearly basis, you would be looking at about 120 million people across the United States who would be eligible for your test. But that doesn't mean all 120 million people will take your test. So that brings us to the serviceable addressable market. It's the segment of the market that would be most likely to use your product and that you might be able to approach. And that would, in this case, would be people who are at increased risk of getting colon cancer, maybe because they have family history, they have other genetic predispositions or risk factors. And those people will be more likely to go in and ask for a regular screening. And that's about 45 million people in the United States with a $22 billion market that Guardant estimated. But the reality, again, is, even with that many people who might be motivated to take your test, you might not be able to sell to all of those people. Maybe because, you're not able to produce 45 million tests a year. You don't have the sales force to target 45 million people or the clinicians who are seeing these 45 million people. You might not have the sales team to go sell for you. So you have to adjust in the beginning, at least when you go to market, you have to adjust your expectations of what you can sell. And this is defined as your serviceable, obtainable market. And Guardant, because they are an established company, they have a sales and marketing team, they have better resources, we're more optimistic than others going into market for the first time, said they would be able to obtain 25% of the market when they go in, and that would give them an annual revenue of $6 billion. So moving from that to thinking about our second example, I don't know why my slides are running on their own. We're going to talk about a digital health product. And in this case, I'm talking about a health and wellness app. And as you guys are familiar with it, I have a bunch of logos of different wellness apps that exist in the market today. And what these apps are doing is providing you some kind of platforms to help you improve and maintain your health by having different features and tools. And some of these, you're familiar with. They might have personalized fitness plans. They might do provide mental health resources. They might provide professional guidance, etc. But if you go to people and start asking them about their experience, and unless they're really focused on one aspect or a specific app for a specific reason, a lot of people might say, oh, you know what, these apps don't provide holistic tracking. They don't provide personalization. They might give you a slew of reasons where they say there are things that they would like to see in an app. And so now, if you have an app that you've developed that hits 3 of those existing unmet needs, you have a product that might be viable, that people might want to use. And that would, in this case, I randomly picked and I said, I have a wellness app that does holistic tracking, that provides professional guidance, and has scientifically validated data, and therefore people would want to use my app. So now let's do TAM-SAM-SUM for this. And here I've put some calculations to also help orient you to how we get to these numbers. In this case, if you wanted to be totally optimistic, you can say everybody wants a health and fitness wellness app because everybody wants to be, fit and healthy. So you can say 8 billion people might want to use my app, although 8 billion people won't use your app because many of them are children. And many of them don't have internet access. So we come up with this idea that there's 60% of the world's population that has access to the internet. And about 20% of those users are likely to be motivated, at least when you first launch your app, to want to use it. So from 8 billion, by taking 60% and then another 20%, you have 960 million people who could use your app. And if you had an annual subscription of $50, you could potentially make $50 billion a year. But you're not going to be able to go in and market to everybody in the world when you first launch your app. You might not even have the resources to scale your app to support 980 million users. So you start targeting a population in the United States, and your addressable market here within the United States would be starting with the population of America, and then thinking about what percent of people have internet access, and then what percent of people are you going to be able to reach and convince to use your app early on. And that's about 74 million people. But that's still not realistic because when you start a company, you don't have the resources to scale your app to reach 74 million people. You might not have the sales force that will be able to go out and sell to 74 million people, and you might not have the marketing budget to even let 74 million people know that you have an app that they can benefit from. So conservatively, most software companies tend to try to say, we are going to be able to sell to 5%. And that, with that number in mind, 5% of 74 million would give you about 3.7 million people. And at your $50 annual revenue, that is, if everybody subscribed, you have the ability to make up to $185 million. So why are we doing this? What's the point in getting these numbers? And especially sometimes when those numbers might not be completely accurate, they're very informed guesses, as accurate as you can get them to be, but they're not it. But just having this set back of the envelope calculation to look at the market size, it will tell you whether your product is viable or not. So again, if you're spending more money to make your product than you're making in selling your product, it's not viable. This will also, as you're doing your research, segmenting your market and seeing where you're most likely to be able to sell, you can identify the most lucrative segments and then focus your marketing and sales strategy towards that. Understanding the market and sizing it and looking at it will also help you come up with a pricing strategy and figuring out distribution channels and how to reach people. It also helps you determine your go-to-market strategy. What I mean by go-to-market strategy is when you first launch a product, you have to think about how you're going to sell it, who you're going to sell it to, in order to start capturing the market. And again, this is sort of related to identifying the most lucrative segment, identifying their goals, and really starting out by phased entry through SOM, through your serviceable, obtainable market. Another important reason why you need these numbers is to talk to investors. Investors are really putting in money in order to know if they can make money. So you have to show them that you have a big enough market or enough of a niche market to be really able to make money from selling your product. It will also help you understand what resources you need in order to capture that market. So, to develop your product to market and scale, and you can provide investors with a number because most investors will ask you, how much money do you need? And that's where you come up with this number. And it will also help you come up with a valuation for your company, which helps figure out who gets how much share when they invest. So moving on from, having a product that you figured out it's viable, but you have competition. So what you're looking to do is through competitive analysis, you want to find who your competitors are. You want to see what products and services they offer, and you want to compare your own product against your competition, and then also look at the strategies that your competitors are using to get to market. And some of the tools that I like to use for competitive analysis are templates that help you, really do head-to-head feature comparisons. So if you take your product, list out its features, you can start to see who has the same features. Are there features that your competitors offer that you don't? And then you can really start to position yourselves against them. You could have a 2x2 matrix if there are two really important features that are needed. So if you have, say, a diagnostic test, two things might be, the cost of goods and services to develop the test,
黄色的笔在你这。
and the turnaround time for the test. And you might want to lower both your COGS and your turnaround time. And so again, you can start stacking up your competitors on a 2x2 matrix to see if they offer both of these or if what they're lacking. You could do a SWOT analysis where you look at the strengths, weaknesses, opportunities, and threats that your competitors may pose to your product. And then the other thing you want to be really thoughtful about and make sure that you address is building a moat. Another question that investors ask, how do you build a moat? And what they're asking you is, how do you make sure that somebody else is not going to come up and eat your food or, take the market share from you? And ways to do this is, number one, you want to make sure that you have the best technology or at least the most competitive technology and continue to invest in innovation and development. You want to have intellectual property that we will talk about next week. You want to build brand loyalty by really focusing on your customers and making sure they're happy, they like your product, they get what they need. As you scale and grow, you want to make sure that you keep the cost of goods and services, so the amount of money you need to develop the product is low. We just heard about the regulatory pathway. You want to make sure that you check all the boxes for the regulatory pathway and have FDA approval, especially if your product is going to need to be reimbursed by insurance. Because if you don't do that, insurance doesn't reimburse, people have to pay out of pocket, less likely to buy your products. In terms of high cost of switching, I'm not suggesting you put a, contract where there's a termination fee, but rather your product is so well integrated and that when customers want to swap it out with a different product, this is more applicable to digital health tools, that it's not easy to just kick you out of the system, but that you are really integrated and it will be a little bit of a barrier to get you out. So the last topic we're going to touch on is talking about the spin-out strategy. I have about a minute, so I'm just going to put up the slide and let you think about the pros and cons. There is both, if you out-license, meaning you develop the technology in your lab, but instead of starting your own company, you license the technology to another startup or a well-established company, it definitely comes with lower risk. It gets you money right away. It also maybe makes it more possible for your product to get to market because there is a well-established infrastructure if it's a large company. But on the other hand, you have limited control of your product, its development, its future plans. It will give you lower returns because you're just selling an early technology, not a fully baked and marketed product. It will make negotiations complex if you wanted to say, add clauses for royalties and other things in the future. And there is sometimes potential of losing your technology if a big company, licenses it, but then decides not to develop it. On the flip side, when you develop your own company, you have more control, you can grow and scale your company, get more returns. As an entrepreneur, that's the satisfaction that a lot of people enjoy and crave. And you have a big ecosystem of other founders and investors who are always around to support you. Of course, there are risks, or I don't like to call them cons. It's challenges. It's higher risk. You need more capital to be able to start your own company. You have challenges around operations and fundraising. And in the beginning, you might have to do it all. And then you also have to deal with your competition. So as you make these decisions, you really have to think about what your risk tolerance is, what your personal goals are, what your technology is, how complex it is to take it to market, what resources you have available, and think about both your personal and career long-term vision. I will share the slide so you guys can go through it on your own. With that, I would like to quickly summarize what we talked about today is that you really need market analysis to plan commercialization of your product and minimize risk and maximize chances of success. You need market research analysis to be able to effectively size your market to determine product viability. You need competitive analysis to make sure you are stacking up against your customers, against your competitors, and you're also protecting your product from competitive takeover. And the last thing is you want to think about your goals and ambitions in terms of whether you license or build your own company. So once you have these, once you've done some market research, you're able to start to fill out your business fields for the target product profile. And just like David talked about with the regulatory process, you really want to make sure that you have a market research plan, you outline your goals, you have clear methods and resources identified. You want to engage with the program PIs and their teams, and by their teams, I also mean their business development officers at the Office of Technology Management, because they have done a lot of this market research analysis for some of the projects. There is a Bay Area I-Corps training program. There is one in August. It kind of runs towards the end of your internship. But if you're interested in it, I would love to talk to you about it, and maybe some of your projects can go in and try it out next month. You also have some resources in us, your mentors, so come talk to us. And of course, use any online resources to search and put together the data that you need. With that, I'm going to stop, take questions. I have my email here. I'm going to share these slides, and I have a link to office hours if you want to talk to me about it.
Hey, Sohaila, thank you so very much. That was really a nice overview of the different considerations on assessing the market and what sort of aspects are important, and some good advice at the end there for the interns on the fields. And so I want to thank you all for joining tonight. Especially want to thank David Pudwell and Sohaila Shah for giving two great presentations. And we have the next week workshop coming up. I think it's the week after next, and hopefully you'll be able to dial in to that. And so again, thank you all very much for joining, and we'll see you in a couple weeks, if not before. Okay, bye.
I think the next week is intellectual property.
Oh, thanks for clarifying. It's next week. Sorry, I should have looked it up before I said something. In fact,
Thank you.
it's funny. Yeah, it's next Wednesday, the 17th. So I had it on my screen. Next Wednesday, a week from tomorrow. So thank you all very, very much.